The following video outlines common exercises that may be prescribed during rehabilitation after a knee replacement. These exercises are intended for educational purposes and should be performed according to the guidance of your surgeon, physiotherapist, and individual recovery plan. Recovery timelines vary from person to person, so not every exercise shown in this video will be appropriate for everyone. If you experience significant pain, dizziness, shortness of breath, chest pain, or feel faint while exercising, stop immediately. One knee flexion exercise is sliding your foot under your chair as far as you can until you can feel a stretch. And another exercise is when you're sitting down or lying down, you use a belt or a strap around your foot to gently bring your knee into a greater bend. One variation of a knee extension stretch is with a foam roller or rolled towel under your ankle, and you allow your knee to straighten. Relax and let gravity assist you with this stretch. Another stretch is a heel prop. You place your heel on a chair, stool, or pillow so that the knee is unsupported, and you allow your knee to gently straighten while you remain relaxed. You can also sit with your heel on the ground in front of you and gently lean forward until a stretch is felt behind the knee. You can also do this on the stairs by placing your heel on a step and gently shifting your weight forward while keeping the knee as straight as possible. You can also add a light weight on your ankle to help you regain that extension. Place a rolled towel or foam roll under your knee and straighten your knee by lifting your foot off the surface. You can also sit and slowly straighten your knee and then return it to the starting position. In both of these exercises, we're focusing on tightening the muscles on the front of your thigh. We can also lie on our back, tighten our thigh muscles, and lift our leg while keeping our knees straight. For the glute bridge, you're going to lift your hips up while keeping your feet flat on the ground. Squeeze your glutes at the top and lower back down slowly. The bridge can be progressed by performing the exercise on one leg and focus on keeping your pelvis level throughout the whole movement. For heel raises, you're going to rise onto your toes and slowly lower back down, and this will help strengthen the calf muscles. To increase the challenge, heel raises can be performed on one leg, and you can hold onto a stable surface for support if you need. For mini squats, have your feet shoulder width apart, bend your hips and knees slightly while keeping your chest upright and returning to standing. For a sit to stand, you're going to be sitting down and standing up without using your hands if possible, and slowly sit back down. For the hamstring curl, you can stand and bend your knee and bring your heel towards your glute. So for the partial lunge, you're going to step forward and lower your body slightly while maintaining good control and balance. And as strength and mobility improves, full lunges can be performed through a larger range of motion to further challenge the muscles of the lower body. For hip abduction, you're going to stand tall and move your leg out to the side while keeping your trunk upright and hips facing forward. So you're going to step down with the good leg while the operated leg stays on the stair, and you can use the railings as much as you need to reduce pain. For step ups, you're just going to step up with the operated leg, and again, use those railings as you need. Hinging at your hips and leaning forward will also help with this exercise. So you're going to lift one leg while holding onto a wall or counter and let go as you feel more comfortable. And then for tandem balance, you're going to stand with one foot in front of the other beside your kitchen counter or a corner of a wall, and imagine you're standing on a rope.